Okay. This is Dr. Iman Khair. I'm going to present or talk today about oral manifestation of endocrine diseases, which is a part of oral medicine course. And as we have, this is the main campus of the National University in Khartoum, and actually this is the house of dental school in the first floor of the gray building, and the second clinic to the left of the picture, the orange one. This is the dental clinics. Okay, now we talk about endocrine system. What is endocrine system? Why do we need to know about it? And the importance of this lecture. As introduction, the endocrine system is responsible for hormonal secretion and is closely related to the central nervous system, as it attains its function through hypothalamus or pituitary gland. It control the physiological process and maintain homeostasis all through the body. وطبعا we know يا اخوانا انه الاندوكراين بما انه الهرمونز are released and secreted into the bloodstream, معناها it affect every and each organ in human body. Unlike exocrine glands, زي السليفري glands, which has السكريشن بتاعتها ما بتمشي للبلاد زي الصلايبة مثلا. عشان كده احنا اذا اتكلمنا عن الصلايبة او مثلا اللاكريمال جلاندز او كده، بنلقى انه الافكت بتاعت الاكزوكراين جلاندز usually بتكون localized, while endocrine glands, as if the hormones are released في blood, then all systems are affected. The neuroendocrine system is responsible for adaptation to environmental changes. Therefore, in dentistry, it is important to be aware of risks and difficulties or challenges that may arise during dental treatment of patients with endocrine disorder, and that visit to dental clinic often represent a stressful condition, as we all know. This is actually one of the aspects. There is another aspect which is the concern of the today's lecture. These are the main parts of the endocrine system: the hypothalamus and the pituitary gland, which regulate the other glands like thyroid, like adrenal cortex, which is located at the apex of the kidneys, and the pancreas and gonads. Endocrine system, as we said, we have two main aspects to diagnose patient with endocrine disorder or a manifestation of endocrine disorder. That is dentist, hygienist, and specialists, certain specialties like periodontology, or specialists like orthodontist and periodontist should be familiar with oral manifestation of endocrine disease. The other thing is that dental management of patients with endocrine disorder, as a dental visit, as we said earlier, represent stress, the surgery, the infection associated with the dental condition or diseases. Oral manifestation of endocrine dysfunction may be observed initially by dentists. Objective manifestations such as exophthalmos in hyperthyroidism, sign of hypersecretion of growth hormone in acromegaly are easily recognized. Addison disease is number one. It's a rare endocrine disorder, but a potentially life-threatening emergency condition. Addison disease is actually a disorder. We have Addisonian crisis that is a risk during dental treatment. So Addison disease result from failure of adrenal gland to secrete cortisol and aldosterone, and also it's associated with androgens. Causes for this insufficiency could be related to autoimmune, use of steroids, tumor infections, and abnormal development of glands. So what are the clinical features for Addison disease? We have pigmentation, that is brown or black oral pigmentation, which are patchy distributed on the gingiva, buccal mucosa, and lip, and should be clearly or should be differentiated from the other causes of pigmentation of the mucosa. And on the top of the list is what we call racial or physiological pigmentation. Other features include lassitude, anorexia, weaknesses, and GIT disturbances, loss of weight, and low blood pressure. Risk of Addisonian crisis, which is a fatal condition with infection, injuries, surgery, and stressful condition. And I have to tell you that I'm here trying to shed a light on the oral presentation or oral manifestation of endocrine disease. However, the part that deal with how you should manage patient with endocrine disorder should be mentioned in other part of the courses, like management of medically complex patients. So we come back to the Cushing syndrome, which is occur when human body is exposed to high cholesterol level for an extended period of time. Etiology is due to overproduction of ACTH, adrenocorticotropic hormone, that stimulate the adrenal gland to produce excess cortisol. Etiology, as we said, either endogenous due to problem with the adrenal gland or exogenous etiology. An endogenous cause is usually due to tumor on adrenal gland, which lead to excess cortisol production. Cushing syndrome, an exogenous cause is due to excessive oral or injectable corticosteroid use. An oral corticosteroids such as prednisolone, which increase the amount of cortisol in body. They are prescribed to help alleviate symptoms associated with chronic inflammatory diseases such as SLE or rheumatoid arthritis. If we talk about symptoms of Cushing syndrome, there are many features that include weight gain, especially in face and abdomen. It's actually related to the fat redistribution maybe, with the fatty deposits, diabetes, hypertension, hirsutism in the women, which is increased hair in areas that are actually occur in men, like area like mustache, area of the chin, and so on. Proximal muscle weaknesses and osteoporosis. And osteoporosis is very important for us as dentists because the bone is brittle and can break easily. So this is one of our concern. The treatment of Cushing syndrome depends on the cause, and most common treatment is through surgical intervention, especially if there is a tumor or something, or maybe medication, especially for those that cannot undergo surgery. We come to one of the gland اللي هي البنكرياس. The pancreas is located across back of the abdomen behind the stomach, and they play a role in digestion and hormone production. في الهرمون production pancreas produce insulin and glucagon which regulate level of blood sugar. And we know diabetes mellitus, which is a very common endocrine disorder, result from relative or absolute deficiency of insulin causing increase in blood glucose. We know there are many types, في type 1 و type 2 وفي gestational that occur during pregnancy. Type 1 symptoms typically appear before the age of 25. A disease is severe with features like thirst, polyuria, hunger, and loss of weight and proneness to infection. Type 2 occurs usually around middle age and mostly around obese. Onset is insidious with deterioration of vision or pruritus, that is severe itching, polyuria, and thirst and fatigue. And sometimes it might be asymptomatic and diagnosed incidentally. If we talk about complication, oral complication or oral manifestation, diabetes is very important, of paramount importance for dentistry or dental professionals, because people with diabetes are susceptible to infection, particularly candidiasis, which is a fungal infection, and we come through that. And we mentioned at that time that diabetes is one of the precipitating factor. Other infection, bacterial, we have the periodontal disease. Periodontal diseases, diabetes cause acceleration of periodontal diseases if poorly controlled. Periodontitis risk is found to be 3 times greater in diabetic patient than in general population, and it may worsen with diabetes evolution. Dry mouth with subsequent complication اللي هي xerostomia، ودي ممكن تكون due to disease itself or could be due to oral hypoglycemic, for instance. Parotid gland enlargement, what we call sialoadenosis, is one of the feature of diabetes. Oral lichenoid reaction, mostly due to medicines or medication used. Hypoglycemic and hyperglycemic coma, those are emergencies that need to be managed, and that is actually with the dental management. Cardiovascular diseases, renal diseases, and retinal damage are complication of diabetes mellitus. Then we come to pregnancy. And pregnancy, we have oral effect include aggravation of gingivitis and possible development of pregnancy epilepsy, and variable effect on recurrent abscess ulceration. And actually during treatment, avoid laying patient in supine position. This is a part of dental management to avoid risk of hypotension. Consider potential association with hypertension and diabetes and iron and folate deficiency. And maybe that's the cause for recurrent abscess ulceration that may occur during pregnancy because of iron deficiency. Possible risk with sedative and anesthesia, such as benzodiazepine, can lead to respiratory depression, nitrous oxide, which can also lead to vitamin B12 deficiency. And we actually have effect, the relation between pregnancy and periodontal disease. We have to say it's a reciprocal relation. It affects and causes that the pregnancy epulis. At the same time, periodontal disease can affect the pregnancy, and we have to talk about what we call premature birth or low birth weight that is related to periodontal diseases. And there are many mechanisms that I think this is beyond the scope of our lecture, but there are many mechanisms how periodontal disease affect the pregnancy in terms of causing premature birth or affecting the weight of the neonate or the fetus maybe. Okay, we come to the possible risk to fetus during dental treatment. X-ray hazard, especially in the first trimester. And in this part, I think we also shift to the other part or other aspect, how the fetus is affected, rather than what are the manifestation of oral manifestation of pregnancy. We couldn't say actually this part as the pregnancy epulis because it's not pathognomonic. Gingival enlargement can occur in different situations, due to different causes. So not only the pregnancy. So I think here we should talk about the reciprocal relation between both the pregnancy and the oral conditions. Another thing that is risk of medicines such as tetracycline, which can lead to staining of teeth, thalidomide, which are teratogenic, and aspirin that can lead to hemorrhage. So these are the relation with pregnancy. We come to thyroid and parathyroid gland, which are located in the front of the neck below the larynx. The thyroid plays an important role in body metabolism, while parathyroid gland, they have an essential and important role in regulation of body calcium balance. A thyroid is a major regulator of metabolism and affects all body function. A thyroid dysfunction is the second most common glandular disorder of endocrine system, which may affect any system in the body, including the mouth. Our oral cavity is affected by either excess or deficiency of this hormone. If we talk about excess, that is hyperthyroidism, which is excess production and release of thyroid hormone by thyroid gland, resulting in inappropriately higher serum level. Graves' disease is the most common cause. It is an autoimmune condition that results in excess production of T4 or T3 with enlarged thyroid gland. The usual negative feedback loop is not effective because antibody is directed against TSH or thyroid stimulating hormone receptor. Individual with family history of hyperthyroidism or other autoimmune may be affected. And here we can see this is what we call exophthalmos, and you can easily tell that this patient has hyperthyroidism. Here is actually the oral manifestation of hyper and hypothyroidism. In hyperthyroidism, we have increased susceptibility to periodontal diseases and caries, enlargement of extraglandular thyroid tissue, burning mouth syndrome, accelerated dental eruption, maxillary and mandibular osteoporosis, development of connective tissue like a Sjogren syndrome, or systemic SLE, systemic lupus erythematosus. And actually autoimmune diseases are usually, they come together. So with the Sjogren syndrome, if patient is susceptible to one of these autoimmune, they usually, or they might have another form of autoimmune, because the body is actually prone to what we call autoimmune phenomenon. Then we come to hypothyroidism, which can lead to salivary gland enlargement, compromised periodontal health, like delayed bone resorption, macroglossia, glossitis, dysgeusia, or abnormal taste, delayed dental eruption, enamel hypoplasia in both dentition, anterior open bite, micrognosia, thick lip, and mouth breathing. Then we come to what we call parathyroid hormone. Parathyroid hormone secreted by parathyroid glands, which are closely associated in location with the thyroid gland, and has a key role in regulation of calcium and phosphorus metabolism, and play an essential role in tooth and bone mineralization. Disorders of parathyroid gland most frequently result in abnormalities of serum calcium and can induce various oral and extraoral manifestation. Therefore, a sound understanding of this condition is essential, with emphasis on alerting sign, clinical and radiological find, and mandatory communication with the physician. طيب بالنسبة للأورال manifestation of patient with hyperparathyroidism, we have brown tumor, which is bone, it's actually not, it's bone lesion characterized by resorption of the bone or destruction to the bone, and it's usually brown in color at histological level due to presence of certain protein like hemosiderin, and there is a decrease in bone density, tooth mobility and drifting, indistinct pain of jaw, sensitive teeth, soft tissue calcification, because dental abnormalities like development of defects, alteration in dental eruption, and obliteration of bulb chamber by bulb stone, and lithiasis, which is formation of stone within the gland or a salivary gland or salivary gland duct. And all of this because it affects the regulation, or what we call the regulatory mechanism of calcium metabolism is affected. We come here to hypoparathyroidism, which result in enamel hypoplasia, delayed dental eruption, oral chronic candidiasis, which is actually in a part of autoimmune polyendocrine syndrome, tongue and lip paresthesia and facial twitching can occur, and this is also due to let's say defect in calcium. And we know, as we said, it regulates the calcium metabolism, so it affects, number one, the release of calcium into the bloodstream from bone, and also increase or regulate the absorption from intestine, and regulate the excretion of calcium in the kidney. Therefore, it maintain the optimum level of calcium in blood. So if this regularity mechanism is affected, then there will be a problem. And as we said, the lip paresthesia and tongue, because the calcium affect the neural function, the transmission of impulses, the response of tissue. So calcium is very essential. We come to what we call human growth hormone. This is actually originally responsible for growth regulation during childhood, also responsible for regulation of many other basal metabolic function, and operates as acute phase stress reactant. So it's not only during childhood. Human growth hormone induces growth in nearly every tissue and organ in the body. However, it's most notorious for its growth promoting effect on cartilage and bone, especially in adolescent year. We have disorder either excess like acromegaly, and we have two acromegaly and what we call gigantism. What is the difference between them? In acromegaly, typically result from growth hormone secreting pituitary adenoma with an onset after closure of the epiphyseal growth plates, typically in adulthood. So acromegaly, in a simple term, occur after adulthood. Therefore, bone growth primarily affect flat bones such as skull, mandible, sternum, hands, and feet. Often, the presenting complaint is of hats or gloves not fitting anymore due to swelling of the hands and head. Also, we have very common complaint that denture is unfitted anymore, which is a major complaint among our denture wearers and in large organs such as a tongue. Acromegaly, in addition to acromegaly is, in addition to bony growth, there is growth of myocardium resulting in hypertrophy and subsequent heart failure in later stages. Diabetes and hyperlipidemia are strongly associated with this disease. Treatment consists of surgery, radiation therapy targeting the underlying adenoma, as well as symptomatic relief of secondary effect of human growth hormone. And actually with treatment, the problems like enlargement of the mandible and these things will be reduced. Earlier diagnosis, earlier initiation of treatment improve the patient outcome in a myriad ways. These are the features you can see here from the right and left. Same person with the enlargement of the or prominent forehead, enlarged nose, soft tissue طبعا, والليب والtongue والprominent chin وجوز. ودي كل الستركتشرز الموجودة هنا will be affected يعني to some extent. And as we said, there is mandibular overgrowth or protrusion of the lower jaw, وعندنا spacing of the teeth, عندنا enlargement of tongue. These are actually the oromaxillofacial feature of acromegaly. Here you can see the malocclusion with class 3. This is the enlarged tongue, proclination or prognathism. This is the spacing or what we call like diastema. These are the feature. Here we can see also enlargement of the gingiva, and look, what we call the bony exostosis are common feature also. That's why the patient come telling there is lack or the denture is no longer fitting. This is actually one of the effects that occur with the radiograph. A gigantism is different than an acromegaly. The illness is very similar to acromegaly in all aspects, except the underlying pituitary adenoma developed before the closure of long bone epiphyses. Therefore, a bone growth occur in long bone such as tibia, fibula, الفيمر والهيومرز والراديوس والulna. So you can see with the gigantism that the whole body is enlarging, okay, while that one only certain areas. Since epiphyseal closure occurs before adulthood, this is typically an illness with onset seen in children. The organ and metabolic impacts are similar to acromegaly. If we talk about the deficiency, then childhood onset is associated with decreased growth of all skeletal structure, lead to dwarfism. Adult onset is less easily diagnosed لأنه بيكون already يعني الإنسان وصل لهنا الطبيعي, as it has no single identifying feature that is pathognomonic. لكن طبعا احنا قلنا عنده functions ثانية. Therefore typically adults have decreased skeletal muscles and increased fat mass in visceral tissues, as well as decreased bone density والremodeling which lead to osteoporosis. Growth hormone deficiency برضو can lead to delayed tooth eruption when it happened during childhood, smaller jaws and teeth, and increased risk of malocclusion. These actually are just shedding light on this presentation of the endocrine diseases. This lecture will be continued as a part of how to manage patients with different oral or endocrine disorders later. Thank you very much. If there are any question, please let me know by posting the question through the platform. Thank you.